everyone, Dr. Louisa here, and you're welcome back to our podcast where we discuss and we explore all things health. And today, our main focus is about maternal and infant health. And we're going to have a very special episode which is dedicated to one of the most natural but often misunderstood topics, which is breastfeeding. And joining us today, I have two wonderful guests. We have Dr. Josephine Mensah Onuma, who's a medical doctor from the Department of Obstetrics and Gynecology at the Gawest Municipal Hospital. And she's bringing years of her clinical expertise so we can, directly discuss the topic and then get into it. And then we also have registered dietitian, who is Madam Joycelyn Yeboah, and she's here to introduce us to the Nutri-Mum breastfeeding powder. So a very special welcome to both of you. Thank you for joining me.
Thank you for having us.
All right. So I think we can get directly into the topic. Doc, breastfeeding, we all know breastfeeding is very important. That's something that has been drummed into our heads. But why exactly is it so important?
So breastfeeding has a lot of documented benefits, both short-term and long-term.
Okay.
Not just for the baby, but for the mother and even for the society as a whole.
Right.
So for most campaigns on breastfeeding have been targeted are talking about the benefits to the baby.
Right.
But then I would want to highlight the benefits for the mother as well, because I have an obstetric bias.
Right.
And also because I feel that the mother should know what they stand to gain. So for the mothers, in the immediate period after delivery, the womb is supposed to shrink, and that reduces bleeding. And when you start breastfeeding early, it helps that process to start faster and more efficiently.
Right.
So it reduces bleeding after birth.
Okay.
Again, it helps you to bond with your baby. And it's also a form of contraception. There's something that we call lactational amenorrhea. And so for mothers who breastfeed very well, they'll tell you that months after delivery, they still do not have their menses. It's all part of the benefits of breastfeeding.
Okay.
Again, it also reduces your risk of having uterine cancer, breast cancer, and even ovarian cancer.
Okay.
And I must say that it's not necessarily the act of breastfeeding, but then breastfeeding is governed by a lot of hormones.
Right.
And so it's the play of these hormones that gives you the protection from breast cancer, uterine cancer, and then ovarian cancer as well. For the baby, the benefits are numerous. So it helps with cognitive development. It helps with brain development. It helps the baby to develop a very robust immune system.
Right.
And then also it helps to develop the gut. So in obstetrics, we know that the guts of babies are not fully formed at the time that they are born.
Yes.
And so it's important that you start feeding them early so that the gut continues developing. And in breast milk, you have, apart from the nutrients that you also have growth factors, you have hormones. And all of these hormones play a role in developing the gut. Also, it reduces the baby's chances of developing obesity in adulthood, and also reduces your chances of developing certain chronic illnesses in adulthood.
Right.
So there are so many benefits for both the mother and the baby. Again, it helps the mother to save money, because if you are breastfeeding, then you will not need to buy formula. And we all know that formula can be quite expensive.
Very expensive,
yes. Once it's building your baby's immune system up, there are less chances of the baby getting ill. And so less off days from work for you, sending your baby to the hospital and all that. So that's how it helps the economy as well.
Wow.
So less off days at work, more productivity, more money in your pockets.
Yeah. Wow, that's an interesting perspective to look at it from, because most of the time when we're discussing breastfeeding, we're thinking about the benefits to just the baby. But now we're learning a lot about the benefits to the mother, and even to the extent of protecting you from some form of cancers. So here in Ghana, there are a lot of myths surrounding breastfeeding.
That's true.
We hear new ones every day. I'm sure you hear a lot of them, especially from where you sit. So can you share some of these myths with us, and then, just debunk them, just for us to be clear in our minds about that?
Sure. So the biggest myth that I've heard is that women with small breasts cannot breastfeed. And that's not true. So when you look at the anatomy of the breast, we have the glandular part and then we have the fat. And it's the fat that accounts for the differences in the size. Every woman, irrespective of the size of your breasts, you have at least 12 lobes which are functioning. And it's the lobes that produce the breast milk. So irrespective of the size, once you do not have any birth deformity, then you are more than capable of producing breast milk and breastfeeding your baby. Again, you also hear that, the baby will become bored of the breast milk, and it's actually likened to adult diet. So you are told things like, if you were given just one food, banku and okro, every day for 6 months, won't you get tired of it? But then I tell myself, if banku and okro is all I've ever known, and I know the benefits in it, there's no way I'm going to get tired of it.
Yes.
Breast milk is all the child has ever known, and so the child is not going to get tired of it.
Right.
Yeah. Again, you also hear things like, when you breastfeed and you don't give the baby water, the baby is going to get thirsty, which is not true. Because mothers who breastfeed will tell you, and those who express the breast milk, when you start expressing, the first 10, 15 mils that comes out is basically just water. It looks like very dilute breast milk, and it's actually made up of 90% water. So in the first few minutes of breastfeeding, all the baby is drinking is water before the actual breast milk starts coming out. So there's no way the baby is going to be thirsty. So you do not need to add water when you're breastfeeding. There are so many other things, but then I think
these are the common ones that you hear. So speaking about that, I would like us to talk about exclusive breastfeeding. Talking about what people like to add on to the breast milk. We know that breast milk is just enough. That's all your baby needs. Tell us what exactly exclusive breastfeeding is.
Okay. So exclusive breastfeeding is a process of giving a baby nothing but breast milk for nutritional purposes. A child may be on supplements or multivitamin or certain medication if the child is unwell. But then you do not give water, you do not give formula, you do not give porridge. If you are given water in the first 6 months, you are not exclusively breastfeeding. It has to be breast milk and nothing else except the child needs some medication. And it's supposed to be done for the first 6 months of the child's life.
Right.
Yes, so that is exclusive breastfeeding.
Okay, and I'm sure there are some myths about exclusive breastfeeding.
Yes. So one of the commonest that we hear is a concern that the mothers have. They say that if they exclusively breastfeed for 6 months, when it's time to start weaning and adding foods, the babies do not want to take the food. They are stuck on the breast milk. But in my personal experience and then my professional experience, I've realized that is actually not true. Some children are naturally picky eaters. So whether you breastfeed them for 6 months or less than that, they are still going to be picky eaters. But it has nothing to do with the exclusive breastfeeding.
Right.
Yes. So that's one of the main issues that come up in the hospital concerning exclusive breastfeeding.
Okay. Yeah. So concerning the timing, when should, breastfeeding be initiated?
Okay. So breastfeeding should be commenced within an hour of birth. So that's the recommendation, that if a mother gives birth, if she's stable and the baby is stable, nothing stops you from initiating breastfeeding there and then. And I would want to commend the midwives, nurses, and the anesthetists that I work with in my facility, because they do very well when it comes to this. It doesn't matter the mode of delivery, even if the mother is undergoing a cesarean section. Once the baby is out, cleaned, and the mother is stable, nothing stops us from putting the baby on the mother to start the bonding process and then subsequently breastfeeding. And almost all the midwives that I know of do very well when it comes to this. So even whilst you are still doing the case, the patient is on the table, they bring the baby, put onto the mother's chest, and then if breastfeeding can be started, it's started. And it's very important because, like I said, breastfeeding is governed by hormones. And so there's a need for a trigger for the whole process to start. And this trigger is suckling. Or so when you put the baby to breast, that is when the entire process is started.
Okay.
The breast milk is there, but if the baby doesn't start sucking, the breast milk is not going to come out. So it's very important that within 1 hour of birth, you initiate breastfeeding.
Okay. And when it comes to that initial breastfeeding, we often hear about colostrum, and a lot of mothers don't really know about it. So can you please tell us about colostrum, what it is, why it's important?
Okay. So colostrum is the first form of breast milk that is produced, and it actually starts in the latter part of pregnancy up until 4 days after the baby is born. It's very yellow, very concentrated, And most importantly, it contains a lot of what we call immunoglobulins and antibodies. It also contains anti-parasitic agents, antivirals, and antibacterial agents. This is important because the baby is coming from a sterile environment, that is the womb, and has come into an environment that is no longer sterile. No matter how hygienic you are around your baby, it's still not 100%. And so until the baby's immune system is fully functional, these elements that you find in colostrum offer some form of immunity or protection from common illnesses.
Okay.
Until the baby's immune system is good to take over. And so in my personal experience, I have never seen my own colostrum, even though I have 2 children. And this is because sometimes, because the baby hasn't started sucking, even when you or you squeeze the breast yourself, you are not going to see it, but it does not mean it's not there.
Okay.
Once you put the baby to breast, the baby sucks. It's going into the baby. It's performing its function, but you may not see it with your eyes.
Right.
Yes, but every mother has colostrum.
Okay.
Yeah.
And I mean, amongst nursing mothers, we often hear about lactation issues, people having problems with lactation.
Yeah.
How have the statistics been over the years when it comes to these lactation issues?
Okay.
Is it common?
So currently, the statistics show that most women, about 54.3% of mothers, have some form of challenges with lactation. And it usually occurs in the first 4 weeks after birth. For most of them, it's the first-time mothers and then the mothers who undergo cesarean section. But we've realized that most of the causes are reversible, and with education and then helping mothers through it, they are able to overcome these challenges. It used to be higher, but then with public education and then the emergence of lactation specialists and health workers being trained on how to help mothers establish lactation, it's coming down. Most of the issues that we have are perceived low supply.
Okay.
Yes. Followed by mastitis and then cracked nipples. Those are the main issues that mothers have when it comes to lactation.
Let's talk about hypogalactia and hypergalactia. What exactly are they?
Okay. So hypogalactia is when the mother's breast milk supply is not enough to meet the nutritional needs of the baby. And then hypergalactia is when the breast milk supply is more than what the baby needs. In hypogalactia, most of the causes are reversible. It's just about 1 to 5% that is actually physiological hypogalactia.
Okay.
And so some of the causes of hypogalactia is if the mother does not know how to breastfeed, which happens in first-time mothers. And then also if the baby is not latching on well, so if you don't have a good breastfeeding technique, that also causes hypogalactia. Usually what we do when a mother has hypogalactia is we go into the history and we find out exactly what is happening. We make sure that she knows how to breastfeed. We teach her how to latch on properly. We ensure that she's eating well and getting enough rest, because nutrition and stress management is very important to maintain breast milk supply. So that's what we do. If we check and everything, the mother is doing everything she can, but then there's still low supply, then we recommend that she takes some nutritional supplements to boost her lactation. For hypergalactia, what happens, the issues with that is that because there's a lot of breast milk, the breast becomes engorged, the mother is in some pain, she gets mastitis, and then sometimes the milk comes out with so much force that it chokes the baby. And so for that, what we recommend is that you do what we call block feeding.
Okay.
So you let the baby feed on one breast alone and leave the other breast to become engorged.
Okay.
Because it's a signaling mechanism, it runs on demand and supply. If the baby is not suckling from one breast, the brain will get the signal and then reduce the breast milk supply in that breast.
Right.
If the mother is experiencing too much discomfort in that breast, which the baby is not breastfeeding, she can express just a little bit of the breast milk to give her comfort, but not empty the breast completely.
Okay.
Because if she empties the breast completely, then the brain will take it that demand has gone up, so then supply also has to go up. So that's one way. For helping the babies to avoid choking, we recommend that the mothers breastfeed the babies lying down.
Okay.
So that gravity pulls part of the breast milk back so that it does not all come out with force.
Into the mouth, okay.
Yes. So those are some of the ways of handling those issues.
Okay. So, Doc, I want to find out from you, from a medical standpoint, what's your view on, supplements, taking supplements to assist with breastfeeding?
Well, so WHO has said that the decision to breastfeed should be treated as a public health issue and not a lifestyle choice.
Right.
So for some women, they prefer not to breastfeed and rather give formulas. But I am against formulas. There's a code against breast milk substitutes.
Okay.
So it should be available, but you should not advertise it.
Okay.
Because breast milk is far superior to formula.
Right.
So if a mother has a genuine issue with lactation, I am all for any product which will increase her supply, get the breast milk to the baby, as opposed to going to buy formula.
Right.
So I don't have any issue against supplements for boosting lactation. If it's absolutely needed, by all means, the mother should have access to it.
Okay, then that brings me to you, Madam Joycelyn, our dietitian. We know about the Nutri-Mum breastfeeding powder. Can you tell us about it? What exactly is it? How does it work?
Okay. So the Nutri-Mum breastfeeding powder is a supplement that contains galactogogues, which helps the lactating mother produce breast milk.
Right.
So it has the anise seeds, it has fenugreek, it has fennel seeds, which are very rich in micronutrients and antioxidants.
Okay.
And also helps the glands to produce the breast milk supply.
Okay.
So over the years, we've used it in so many hospital facilities. And then we've seen that it has worked. When they take it over the shortest period of 24 hours, they start to lactate.
Oh, wow.
Yeah, and that is the kind of feedbacks we've gotten from most of the hospitals. So yeah, it has the fenugreek, it has the anise seeds, it has the fennel seeds, and these are natural elements or natural products which do not have any side effects on the mother and then the baby. And even the fennel seeds also help the baby so that the baby is not gassed up. And also tackles colic in babies as well.
Oh, okay.
So it's one of the premium supplements that would recommend that most mothers who are experiencing lactating issues should jump on to help themselves and the babies.
Okay, so when it comes to Nutri-Mum, can the mom start taking it before they deliver, or they have to wait till after delivery and then they take it?
Okay, so Nutri-Mum is taken right after delivery.
Okay.
Let's say after, like Doc said, that breastfeeding is initiated in an hour after delivery.
Right.
So after subsequent tries, and then maybe the mother is not expressing enough, or it's not expressing as much as the baby needs, then we can put the mother on the Nutri-Mum so that we can initiate breastfeeding. It can help the mammary glands produce the breast milk. Yes.
So it comes as a powder, I think, in a sachet form. So how are they supposed to take it? Can they mix it with their porridge, or they have to be taken with water, with milk?
Okay. So when it comes to Nutri-Mum breastfeeding powder, you can either incorporate it in your porridges, can add it to your milk, can add water to it. All you need is a scoop of it in about 220 to 250 ml of water. Then you take it. So if it is water you are using, that's the quantity. If it's your porridges, the same quantity. You can even put it in your smoothies or your drink so that you can take it. Yeah.
Okay. So Doc, back to you. I'm very interested in, the act of breastfeeding and, safe practices. What are some of the safe practices or the best practices that you would advise for breastfeeding so we can achieve optimum results?
Okay, so a good breastfeeding session lasts anywhere from 10 to 45 minutes.
Okay.
And we will all agree that 45 minutes can be a long time.
Yes.
So it's important that the mother is comfortable and then the baby is also comfortable as well. So you start by maintaining hand hygiene. You wash your hands if you can. If you're in a place where you cannot wash your hands, you get a baby wipe, you wipe your hands very well. Now you find a position that is most comfortable for you. So you can either sit in a chair, lie down. And if you are sitting in a chair, you need to be upright and your back needs to be against the chair.
Okay.
And then you make sure the baby is also comfortable. So we say that the baby's mouth, chin, and navel should be in a straight line, in a neutral position.
Okay.
So that the baby is not in an awkward position. And then now you bring the baby to the breast. You do not send the breast to the baby.
Okay.
Because if you send the breast to the baby, then you have to arch your back. And then that can have consequences. You can get debilitating back pain several years down the line. So you bring the baby to the breast. And then the latching on technique is very important. I must say that it takes practice. So you may try once, twice, it's not working, but you need to keep at it and then you get better. So we say that you use the nipple against the baby's upper lip or rub it on the baby's nose, and the baby will start opening his or her mouth. And then you pull the baby to the breast.
Okay.
You make sure that there's an acronym that we use. We say CALM. To know that the latch is good, the baby's chin has to be on your breast. There should be more areola above than beneath. So the areola is the black part of the breast outside the nipple.
Okay.
So it's not just the nipple that should go into the mouth, because if only the baby holds on to just the nipple, if it keeps happening, then that's when you get cracked nipples, you get mastitis. So the areola has to be in the baby's mouth. You shouldn't see any areola beneath the baby's lower lip.
Okay.
And then the baby's mouth should be wide open and the lower lip should be curled out. So that is calm. So chin to the breast, more areola above than beneath, lower lip curled out, and then the mouth wide open.
Okay.
And then when you do that, now the baby uses less effort to suck the breast milk, and a lot of the milk comes down, because then you've created you've created a very good pressure gradient. So once you do that, you would hear, sometimes the mother will hear that the baby is swallowing, or you realize that the cheeks are going up and down. That means the baby is breastfeeding very well. The baby will breastfeed for about 45 minutes. Some mothers say that because the baby breastfeeds for too long, that means that the milk is not enough. That's not true. Because when a baby is born, the first day, the size of the baby's stomach is like a cherry, a single cherry. So just about 5 to 7 meals fills the baby's stomach up. But then there's no fiber in the breast milk. So in as much as the stomach fills up very fast, it also empties very fast.
Right.
So in a few hours, the baby will be hungry again. So the fact that the baby keeps crying after a few hours doesn't mean the breast milk is not enough.
Okay.
Because that's some of the reasons that mothers give for going to the formula. So when you put yourself in that position, baby is comfortable, you are comfortable. You can keep going, even if it's for 45 minutes or 1 hour. You know that breastfeeding is going on very well. Again, you should not be breastfeeding and then be on your phone or be distracted. No. We've said that breastfeeding is governed by hormones.
Right.
One of the hormones is what we call oxytocin, which is also what we call a love hormone. Now, the love hormone is triggered by the baby suckling, and then you also focusing on the baby.
Okay.
So we recommend that when you are breastfeeding, you look at the baby, and you realize that when babies are breastfeeding, they look into the mother's eyes.
Yeah.
So you also look at the baby and you bond with the baby. That will cause more oxytocin to be produced. That will cause the breast milk to flow freely. So when you are doing all those things, there are things that you look at to ensure that will give you an idea if the breast milk is enough or not. 1, the baby will stop breastfeeding after 45 minutes, 1 hour. Baby might fall asleep. You realize that you are getting a lot of wet diapers. So you are changing the baby's diapers about 3-4 times in a day. Even if you are not physically seeing the breast milk, once you see those signs, then you know that we've had a very good breastfeeding session.
Right. Thank you for these practical tips. It makes a lot of sense. And so I think we've learned a lot from this session. Before we wrap up, do you have any final words for our viewers?
Yes, so I'd like to speak to the mothers. We've learned today that breast milk has a lot of benefits, not just for the baby, but for you as well. This is a step in the right direction. You are finding out information. You need to find out as much as you can about breast milk. Know what you stand to benefit, what the baby also stands to benefit. And then ensure that you do it, because if you have the information and you do not do it, then all the benefits are lost. As a mother myself, when I started breastfeeding, that's when I realized that society is not as supportive of breastfeeding as we grew up believe in. There are so many things that people will tell you. Unsolicited advice, solicited advice. Once you know what is good for you and your baby, it's important that you stand your ground in a polite way, in a respectful way. If someone says something that you do not agree with concerning breastfeeding, just let them know your stance and stick to it. Because if your baby doesn't get those benefits, you are the one who is going to suffer. For example, just to end, if you do not breastfeed and your baby gets infections, diarrhea or coughs, you are the one who is going to sit in the hospital, by the hospital bed. All those who gave you advice will be in their homes sleeping. But then you are the one who is going to be suffering, sitting by the hospital bed. So know what is good for you, know what is good for your baby, and stand your ground and do what is right for both of you. That's all I have to say.
Thank you, Doc. Our dietitian, any last minute words?
Okay, so you can get Nutri-Mum breastfeeding powder in the pharmacies and in most mother care shops. And also a number is going to be displayed on your screens for you to contact in case you need the supply or you need it yourself to take. And I think that is one of the premium products that people have testified of. So I think that most people should jump on it, all right?
And give it a try. Okay, thank you. That's beautifully said. Thank you very much, ladies, for joining us. We've had a very interesting session today, and I hope that our viewers have learned a lot from this session. Thank you so much for joining us. If you have any questions, please do well to drop it in the comment section, and we will have our guest answer them. Thank you very much. Bye.